now have the pleasure of introducing our first speaker, Dr. Elizabeth Meade, who will be presenting Fitting Advocacy Work into Real Life. Dr. Meade is a pediatric hospital medicine physician at Swedish Medical Center in Seattle. She is the president of AAP Washington Chapter, a previous chair for the AAP section on early career physicians, and a national AAP spokesperson. Dr. Meade is a frequent speaker on advocacy and media work for physicians and a proud advocate for children and families everywhere. Please join me in welcoming Dr. Elizabeth Meade.
Thank you so much for having me. I'm so excited to be here on the last day of what has been a really incredible conference. I have no disclosures since I'm a pediatrician, but I do want to say that I'm honored and really humbled to be here talking to you today. When I was first asked to give this plenary, I have to tell you that I came down with a pretty serious case of imposter syndrome. And I started thinking about all the pediatricians who are better advocates than I am and who have seemingly endless amounts of time and energy and moral fortitude, even when I don't. And then I thought, well, that's actually the point of this talk. This talk is about the everyday advocate, and that is me. That's me when I get so mad about cuts to Medicaid that impact my patients that I write a letter to the editor of the New York Times and they actually publish it. And it's me when I cannot stand to see one more case of measles in my home state, and so I testify and I speak out publicly about the power of vaccines. It's the people I'm going to tell you about in this talk today, and it's so many of you in this room and in this photograph. And hopefully, when you leave today, it's every single one of you sharing this space. Every child in this country and every other country needs an advocate. And every pediatrician has the skills and the time to be a world-class advocacy champion. Every one of you in this room. My goal for this talk is that each of you knows that, and that you know how to harness your own power and the collective power of the tens of thousands of AAP members with one voice. By a show of hands, how many people in this room have ever fought with an insurance company to get coverage for one of your patients for a medicine or a service? Yep. And how many of you have testified in court? And how about interfacing with a school for a child that has special needs or healthcare challenges? That is advocacy. How many of you can think of a story right now that perfectly illustrates a gap in care or a policy that harms kids and families that you take care of? These stories are powerful and they really must be told. You are all experts and you are all advocates, whether you have ever called yourself either one of those things or not. These are some of the barriers that I hear when I talk to people about what's stopping them from jumping wholeheartedly or even dipping a toe into advocacy work. And they're all real, but they're surmountable. Time certainly is often the biggest barrier for people, and we'll talk about that quite a bit today. But lots of other things can cause trepidation, and we'll try to touch on those as well. Today, we'll talk about what it's like to be a child in America and why it's more important than ever that we stand up for them. We'll talk about stories of pediatricians just like you and me who have achieved incredible things for kids despite busy lives that are full of commitments. And then we'll talk about some practical ways that each of us can fit advocacy work into our lives that are already so full of responsibilities, even when we're not sure if we have any time or anything left to give. So let's talk now about what it looks like to be a kid in our country, especially if you are a child who is part of a community or a group that is somehow marginalized. The National Family Center on Homelessness estimates that 1.6 million children are homeless each year. That's 1 in 45 kids. And that number is likely a significant underestimation of the true value. Half of kids in our country live in or near poverty. And 9% of them, which is 6.8 million children, live in deep poverty, which is defined as less than 50% of the federal poverty level. That is less than $13,000 for a family of 4 to live on. For me, that seems unimaginable, and I think that it probably does for many of you as well. And if you're Black, Hispanic, or Alaska Native, you are more than 3 times as likely to live in poverty as a white child. 2,900 kids between the ages of 0 and 19 are shot and killed in our country every year. 3 million more of them will witness gun violence. American children are more than 20 times as likely to be killed by a firearm as kids in other high-income countries. It's the second leading cause of death for children and teens in the United States, but if you're Black, it's the leading cause. These numbers are not tolerable to me as a pediatrician or a public health advocate, and they should not be to you either, or really to any human being on Earth. And if you manage to escape poverty and firearm violence, you now have the threat of reemerging vaccine-preventable diseases to look forward to. We had more than 1,200 cases of measles in this country this year. 86 of those were in my home state of Washington. This is the highest number by far in 27 years, and we came dangerously close to actually losing our status as a country that had eliminated measles. How many of you have cared for a child with a vaccine-preventable disease? And how many of you have shared that story with a lawmaker? Far fewer. These stories are so impactful and important, and they must be told, because it's our duty as pediatricians to spread evidence-based, truthful information that is rooted in science and not in rhetoric. In Washington State, uptake on action alerts from our chapter members were the highest of any issue to date. And this grassroots advocacy was impactful and important in passing legislation in 2019 that eliminated personal and philosophical exemptions for the MMR vaccine. Very exciting. Most of our members who participated in this advocacy work took less than 1 to 2 minutes to do so, just by responding to alerts that our chapter sent out. But we can't wait for outbreaks in every single state. We have to be proactive in our efforts, and we have to speak out publicly about the power of vaccines in preventing disease and preventing death in children. So now I've cheered you up immensely, I can tell, but we're gonna talk about what we can actually do about it. And on the screen, I'm sure many of you know, is Dr. Julie Linton. And Julie is the co-chair of the Immigrant Health Special Interest Group, and she serves on the executive committee of the Council of Community Pediatrics. She, probably you know her from her expert and compelling testimony before Congress and on news media outlets across the country about the inhumane treatment of immigrant children and families at our border. And Julie's story started with just joining the AAP and checking a little box that said, join the Council on Community Pediatrics, because she thought, well, that's what I do. And a few months later, she got an email about a special interest group for immigrant health, and so she joined that. And then a few months later, there was a call to action to help develop a toolkit for pediatricians caring for immigrant families. And Julie thought, well, I can write, okay, I'll do that too. And so she just said yes. And that work led to being nominated for the executive committee, and even though she had small children at home and tons of other responsibilities, she just said yes. And now she uses her skills and her expertise to highlight the inhumane treatment of immigrant children at our borders on a national stage. Julie tells us that we have to say yes, we have to get a little uncomfortable, and we have to use our experiences to fuel our passions. The next story I'm going to tell you is about Dr. Ankur Shah. And Ankur is a general pediatrician at Children's National in DC. During his intern year, and I'm very sorry, I'm going to make everyone in this room feel very old, including myself. His intern year was 2012. But he noticed that he was unable to give the HPV vaccine to foster children in his clinic. And when he asked why, he was told that it was because they needed the written consent of their biological parents, which was something that was nearly impossible for most of them to obtain. And so he asked around, and attendings told him, well, it's just a rule, we can't do anything about it. And that wasn't enough for him. He didn't want to settle for that for him or for his patients. And so he found out who was responsible for the rule, and he met with the Department of Family Services. And using evidence-based information about the safety and the efficacy of the HPV vaccine, he was able to get the rule changed within 6 months. And by the end of his intern year, he was giving that cancer-preventing vaccine to all kids in his clinic, including foster children. And he started to think about, how advocacy can change not just the lives of our patients, but of ourselves. And he became very passionate about using our expertise to inform policy and to educate the public. And on his night shifts or downtime during residency, which we all know is insanely busy, he started writing op-eds and educating himself more. And now, just 4 years out of training, he is the president of the Washington, D.C. chapter, and he's still advocating for kids every single day. This next superstar is Dr. Melinda Willingham. Many of you may know her as well. She's a general pediatrician and a practice owner in the Atlanta area. And when she moved there 5 years out of training, she noticed that many of her patients on Medicaid were not able to access specialty care. When managed Medicaid programs came into her state, that access got even more difficult, and she found her patients using the emergency room just to see subspecialists. And she thought to herself, I am in a major metropolitan area with a children's hospital, and my patients cannot get care. At that time, 67 counties in Georgia did not have access to a single pediatrician. And so she complained over and over and over again to her AAP chapter. And eventually, Dr. Marty Michaels, who became one of her advocacy mentors, said, if you're gonna complain this much, just do something about it. And so she did. She joined her chapter's legislative committee, and she helped them develop a roadmap to getting Medicaid rates increased to parity with Medicare. And because we know that advocacy can be a bit addictive, she ended up chairing that committee. And because we know that advocacy is a marathon and not a sprint, it took them 10 years, but Dr. Willingham and her colleagues were able to achieve 100% parity to Medicare rates and increase access to care for kids in her state. She is a busy full-time clinician. She's a practice owner, actually, of multiple practices, but she says the 1 or 2 hours that she spends every week on advocacy fuels her, it counteracts burnout, and it allows her to speak up for her patients who don't have a voice. So she found a mentor, she led the charge, and she shared the work, which is so critical. And lastly, this is Dr. Nia Hurd-Garris. And Dr. Hurd-Garris is a pediatrician and a physician scientist in Chicago at Northwestern and Lurie Children's. She's passionate about many things, including injustice, ACEs, and racial inequity. She does not shy away from the tough topics. She's also got a young child at home, a husband going back to school, and an elderly parent whom she cares for. And still, she somehow finds the time to be an advocate. And when I asked her how, she told me 2 things. She said, number 1, I'm a pediatrician. Advocacy is not separate, it's just what we do. And secondly, she said, that stakes are so high for kids right now. If I don't speak out, then who? Advocacy work requires us to be vulnerable and to open up our deepest and truest beliefs to criticism. And so when she speaks out about these issues, the critics come out, and she expected them to. But I think all of us know that for every critic, there are many more supporters. And Dr. Hurd-Garris has gotten letters from high school students and lawyers and non-medical people across the country telling her that her public voice has inspired them to find ways to advocate for children. She says that we all need a sense that our advocacy can change the world and that regular people can have impacts to make it a place that we are all proud to live. There are countless more stories that I would tell you, and if we had more time, I would tell them all. But I'd like to say a little bit about you. The AAP is more than 67,000 members strong and has more than 375 staff working tirelessly every day to make sure that children not just survive, but thrive. Can you imagine how loud our collective voice would be if we all spoke up together with one message? I think that it would drown out the harmful misinformation being spread to families, telling them that vaccines don't work, that kids don't know where the guns in the house are, and that it's okay to treat someone differently based on the color of your skin or the language that you speak. But I know that I, just like you, need more hours in the day and more energy to fuel them. And sometimes my life feels a lot like this. The great news is we don't need a lot of time to do this work, and we don't need to do it alone. If you have just 30 seconds, you can take action today that can become part of the AAP Advocacy Network, and you can join that group of key contacts. You'll get weekly emails highlighting advocacy issues and become part of that greater community working for kids. All you have to do is email the address here. You can tweet or post on social media, and if you want to take just 5 seconds, or you hate social media, or you don't know what you're doing, you don't have to create your own content. All you have to do is to retweet something from the AAP or your chapter. Message amplification matters, and this is so important to getting the evidence-based and truthful information out there. If you've got 5 minutes, you can enter your legislator's contact information into your phone so that you're at the ready whenever you have a need to contact them about child health. You can sign up for their weekly email updates. You can offer yourself as a resource. Many of these relationships between pediatricians and lawmakers turn out to be incredibly fruitful and impactful when bills come up that impact child or family health in your state. You can respond to requests from your chapter or from national to reach out to those legislators, or just send an email to your chapter's advocacy lead. It's easy to find out who they are. You don't have to commit to anything. You're not signing a contract. You can just tell them that you're interested in getting more involved. If you've got an hour, this is a great amount of time to draft a letter to the editor or an op-ed. Start with a topic that you're most passionate about. Your chapter can help you figure out how to craft your message and how to disseminate that and submit it to publications. You can schedule a meeting with your legislator. That doesn't have to be in your state capital. It can be in your home district. And in fact, those home district meetings are often much more meaningful. You get more time with your legislator, you get to know them, and the most important thing is to just offer yourself as an expert in child health. They will reach out to you when questions come up. Maybe most importantly, you can compile a list of patient stories that you feel need to be told. It is important that we don't violate HIPAA, and that if we're telling a story where the patient or family could identify themselves, that we always ask permission. But many families will tell you they want their story to be shared, they just don't know how to do it. You can meet with another community organization if you don't want to go the legislative route. And if you've got a full day, you can attend your chapter's advocacy day. You can meet with other families or providers in your community to really find out what the issues are facing your patients that you might not even know about. You might want to become a content expert in a policy that affects kids, something that you have particular skills in or knowledge about. There are lots of ways to do this with unpredictable time as well. And so if you're like me and you're a hospitalist or a shift worker and you have no idea what your schedule is, there are still things you can do. You can offer to become a point person on an issue for your chapter. You can offer to testify on child health issues. These opportunities often come at the last minute, and it may be a day that you have free. And perhaps most importantly, you can come to the AAP Legislative Conference. This conference is held each spring in Washington, D.C. It's in early April this year. Registration is open. I cannot tell you enough how truly transformative this experience is. How many people in this room have been to the Legislative Conference? I see about 20. It is really incredible. It gives you opportunity to connect with pediatricians and lawmakers and AAP staff from all over the country to bone up your advocacy skills, to develop those advocacy muscles, and to really understand the issues in a deep way that are affecting children. I hope that in listening today, you realize some advocacy truths. Number one, you are an expert. You are the experts. The stories that you share about your experiences and your patients' experiences are incredibly important when we talk about policy work that impacts children. You do have the time. It might be 30 seconds one day or 5 minutes the next day, but we can all do meaningful advocacy work in just a few minutes a day. Find a mentor or like-minded colleagues and share the work. If you haven't done advocacy work before, there is someone who will bring you along and show you the ropes. And sharing this work with a community of people can make it incredibly impactful. We are human, so it's important to care for ourselves. This work is not always easy, and we cannot be all things to all people 100% of the time. But many, many pediatricians tell us that doing advocacy work actually prevents and even counteracts burnout and moral injury. Finally, just say yes. Let's fight for kids, and let's do it together. The families and patients that we take care of need us. The kids in our communities need us. Parents that we support need us, and we need each other. Advocacy is not just using your voice, it's lifting up the voice of someone next to you who has something important to say. Thank you so much for listening today, and I cannot wait to see what you all do for children. Thank you.